Are you 64 going on 65? Then it's Medicare time. Time for you to learn about all of your Medicare options, and you need to do it now. Welcome. I am Mark Sanis, and I am the owner of Sanis Insurance. We are an independent Medicare and health insurance agency located in Spokane, Washington, and we are appointed in 14 states. So let's get started. Here is a quick overview of what we will be learning. At Sanis Insurance, we have a Medicare roadmap in 4 easy steps. Step 1. After we talk about your health, financial, and lifestyle needs, we will educate you. You will learn about Original Medicare, Medicare Advantage, supplements, Medigap, and prescription drug plans. Step 2. Once you have your Original Medicare card, you can choose between using a Medicare Advantage or supplement and prescription drug plan. We will compare the pros and cons of Medicare Advantage and supplement plans. Step 3. We will review additional products that fill in the gaps. You will learn all about the various gaps in Medicare Advantage and supplement plans and how these products can reduce and even eliminate those gaps. Step 4. Enrollment periods are very important to know. When and how you can sign up is important. We will also go over some Medicare myths and then review your next steps, what you need to do, and when. So why should you choose us to help with your Medicare needs? Sandy and I have a lot of work experience in the insurance industry, over 30 plus years. We started Sanis Insurance in 2015, so we have 11 years with our own agency. Our office is located at 100 North Mullen Road, Suite 101, Spokane Valley, Washington, 99206, and you can call us at 509-993-9887 to set up an appointment by Zoom, by phone call, or in person at the office. We are also appointed with 30 plus carriers and plans, so we will be able to find a great Medicare plan for your needs. Here's what we provide you: education and service, annual reviews, wide variety of insurance products, year-round service availability. Our services are always free all year round, easy to schedule an appointment, phone, Zoom, office. We have also expanded and we now have customers and are appointed in 14 states. Here is a quick map of the states that we are appointed in. Step 1. Let's learn how Medicare works and what it costs. You may have heard about the ABCs of Medicare, and here they are. You will start by signing up for Original Medicare, which includes Part A and Part B coverage. Once you have completed this, you have the choice of signing up for Option 1, a Medicare Advantage plan, or Option 2, a supplement and prescription drug plan. You can have one or the other option, but not both together. We will discuss the details of each of these options in a few minutes. So Original Medicare covers Parts A and Part B. Part A is hospital coverage. It helps cover inpatient care in hospitals, skilled nursing facility care, hospice care, home health care, etc. Part B helps cover services from doctors and other providers, outpatient care, home health care, durable medical equipment like wheelchairs, walkers, beds, etc., and it helps cover many preventive services like cancer screenings, flu shots, mammograms, and vaccines, etc. Here are the costs for Part A and Part B. Part A, deductible, is $1,736 per event when you are admitted to the hospital. You can have several events during the year, and this can add up. If you stay in the hospital from 61 to 90 days, it will cost $434 per day, and it goes up to $868 at 91 plus days. Again, this can get very expensive. Part A is usually subsidized 100% by the government if you have worked 40 quarters and paid taxes during your work life. If not, Medicare will calculate how much your Part A premium may be. Part B, medical, The deductible is $283 annually. The coinsurance is 20% with no limit. When you have a hospital surgery bill for $100,000 and the doctor portion is $50,000, 20% of that is $10,000. The current Part B premium is $202.90 per month, and there is this little rule called IRMA, Income-Related Monthly Adjustment Amount. IRMA basically is a schedule where if you make more gross income, then your premium for Part B and Part D goes up. They will do a 2-year look back on your income taxes. You will always have to pay your Part B premium whether you get a Medicare Advantage or supplement and standalone prescription drug plan. Once you sign up for Original Medicare, you will receive your Medicare health card in a few weeks, and it will look like this. You can sign up for Original Medicare as early as 3 months before your 65th birth month. We highly recommend signing up early, as processing time for both the Original Medicare and the Part C Medicare Advantage plan, or the supplement and prescription drug plan, can take time, and you want these to start on the first of your birth month. Once you have your Original Medicare card, you can choose to sign up for a Part C Medicare Advantage plan or a supplement and Part D prescription drug plan. So, what are the advantages of a Medicare Advantage plan? Medicare Advantage plans are offered by private insurance companies. Medicare Advantage coverage must be as good or better than Original Medicare coverage. Medicare does not endorse or recommend any plan. They simply approve them to be sold. Most plans will include prescription drug coverage. They call these MAPD, which stands for Medicare Advantage with Prescription Drug. Now, there are different Medicare Advantage plan types. HMO, Health Maintenance Organizations. These are the most common plans as they have a network of contracted doctors and providers that you can go to. PPO, Preferred Provider Organizations. The HMO-PPO plans let you use network doctors like HMOs, and they also let you go outside the network and use non-contracted doctors and providers. The catch is that you will have to pay up to 50% of that doctor's bill. SNP, Special Needs Plans. These plans are for Medicaid and Medicare customers and people with chronic illness situations. To be eligible for Medicare Advantage plans, you must reside inside the service area, be awarded Part A, and pay for Part B. Did you know that the government will pay the carrier when you start a Medicare Advantage plan? They pay by county, and the average amount is $1,000 per month per person. That's how they can reduce the Medicare Advantage plans down to a $0 premium on most of their plans. They don't do that for supplement premiums. Medicare Advantage plans have an annual maximum out-of-pocket limit. This is great as it reduces your exposure to those very expensive surgeries and illnesses. They say that over 95% of the people never reach their annual MOOP. This is a pay-as-you-use-it type of plan. If you are healthy and do not use the coverage, then you don't incur the deductibles, copays, and coinsurance amounts. Now with supplements, you are basically paying upfront and then minimizing the gap costs, the deductibles, copays, and coinsurance amounts. There are extra benefits on the Medicare Advantage plans, and they can vary greatly. That's why working with a Sanus insurance agent can help you navigate the plans and get you what you need. Here are a few of the extra benefits that Medicare Advantage plans can have. Dental, vision, hearing, fitness programs, gyms, over-the-counter stipends, chiropractor and acupuncture coverage, and more. And you get prescription drug coverage with your Medicare Advantage plans. All of this for $0 premiums. Your second option, after getting your Original Medicare card, is signing up for a supplement health plan and a standalone prescription drug plan. Supplement plans are labeled with letters A to N. Medigap plans supplement Original Medicare, so they follow Original Medicare coverage exactly. When you get a health bill, it gets sent to Original Medicare first, and they review coverage, medically necessary, and pay minus their deductibles, copays, and coinsurance. Then they send those amounts to your supplement plan carrier for payment. All Medicare supplements are standardized. The G plan coverage is the same no matter which company sponsors it. By law, it must have the same medical benefits as it follows original Medicare coverage exactly. There are no doctor networks and no referrals with supplement plans. You can see any doctor that takes Medicare assignment in the United States. Enrollment in a supplement plan is different than a Medicare plan. Supplement open enrollment is within 6 months after your Part B effective date. There are no health questions asked about pre-existing health issues. There will be medical underwriting if you do not sign up during the above 6-month time period, and you may have to answer health questions to qualify. Plan G is the most popular supplement. The carriers have varying premium amounts for the same standardized G plan. With the G supplement, you will pay the monthly premium and the Part B annual deductible, which is $283 in 2026. The G plan will pay 100% of all Medicare covered expenses after the annual Part B deductible. And remember, you always have to pay the Part B premium as well. The next most popular supplement plan is Plan N. With Plan N, you will pay the following: Part B deductible, $283. Then you will pay $20 for a doctor visit. Then you will pay $50 for emergency room visits. Plan N will pay 100% of all covered Medicare expenses after copays and deductibles. Policyholders may be billed for excess charges. Washington state regulations allow for portability. You can change plans every month if desired without underwriting and with guaranteed insurability. The new plan will begin on the first day of the next month. Idaho, Oregon, and California have birthday rules. These states allow for changing supplement plans within certain periods, 30 to 60 days, around your birthday. Prescription drug plans. Some of the highlights of these plans include: they are offered by individual insurance companies that have a contract with Medicare. They can be standalone, PDP, or attached to a Medicare Advantage plan, MAPD. In most cases, the standalone PDP plans cannot be added to a Medicare Advantage plan, MA only. Adding an individual standalone PDP plan may result in the cancellation of a Medicare Advantage plan, and then you would be left with just a prescription plan and no health plan. Here are the common tiers of drug plan classifications. Tier 1. Preferred generic drugs. Tier 2. Non-preferred generic drugs. Tier 3. Preferred brand drugs. Tier 4. Non-preferred brand drugs. Tier 5. Specialty drugs. On most plans, your cost for Tiers 1 and 2 is low, if not zero. As you reach the higher tiers, your costs go up. What will you pay for a drug plan? If it's a standalone drug plan that goes with a supplement plan, the premiums range from $0 to $100 per month. If the drug plan is included with a Medicare Advantage plan, then your premium is $0 because that's the cost of the whole plan, health and drugs. Whether your drug plan is standalone or included with a Medicare Advantage plan, you also pay the plan's drug deductible, which is incurred if you have any drug that is a Tier 3, 4, or 5. These deductibles vary by plan and can reach $615, which you must pay in addition to copays for each prescription. Drug plan copays are what you pay when you go to the pharmacy and get your drugs. Each prescription has a copay based on its tier level. These costs can get very expensive with just one Tier 3 or 4 prescription. So, we end up paying for premiums, deductibles, and copays. These costs can add up fast. In the last couple of years, they instituted an annual maximum out-of-pocket limit for all prescription plans. In 2026, the limit is $2,100. We will be discussing this in more detail in a few minutes. Let's move on to some terminology that you should be aware of. The first is quantity limits. This is the number of pills the plan will allow a member to be given at one time. Next is step therapy. This occurs when a member is prescribed a prescription when a lower cost alternative is available. The member may be required to try the lower cost drug before they are allowed the more expensive drug. Then there is prior authorization. This occurs when a member has tried a lesser cost alternative and it is not effective. The client can be authorized to receive the more expensive drug if approved. And lastly, there is transition fill. One refill of a prescription medicine is automatically within the first 90 days after switching MAPD or PDP plans. This allows time for any quantity limits, step therapy, or prior authorization arrangements to be made for certain drugs to be filled properly. This is a good thing, as we don't want to miss taking our prescriptions. Have you heard about low income subsidy, LIS? This is where a person makes less than $24,000 annually and has no investment assets. Qualification is based on your income and assets. If you do qualify, you can get reduced Part B premiums, reduced Part D premiums, reduced co-payments and co-insurance for the prescriptions, and it eliminates the coverage gap donut hole. Low-income subsidy applies to all standalone and Medicare Advantage included prescription plans. There is a good percentage of people who would qualify but don't realize that this is a great benefit. Back in 2024 and before then, Medicare prescription drug plans had 4 phases annually. The first phase was the deductible. Then you moved into the initial coverage phase, where the member pays copays and coinsurance until the total of what the plan and member pays equal $5,030 in 2024. Then you would move into the coverage gap or donut hole phase. In this area, the member pays 25% of the generic retail price and 25% of the brand name retail cost until they have paid the true out-of-pocket limit, which was $8,000 in 2024. This was very expensive. If you did reach this $8,000 annual level, then you moved into the catastrophic coverage phase. In this phase, members pay small copays for their drugs, or 5%, whichever is greater. Did you catch all of that? This is the way it went for many years. There was no negotiating with the pharmaceutical companies on prescription prices, and these high limits were more than most could afford. With mounting pressure from the public, the Inflation Reduction Act was approved and started in 2023. It has a section that pertains directly to Medicare prescription plans. In 2023, the Part D vaccine coverage expanded with no costs. They also capped covered insulins at $35 per month supply. This was a huge savings from the usual $500 per month costs before. In 2024, they eliminated the 5% coinsurance clause from the catastrophic coverage phase. In 2025, they reduced the maximum out-of-pocket for covered prescription drugs from $8,000 down to $2,000 annually. They also eliminated the coverage gap donut hole phase, and they developed the Medicare prescription payment plan. Now, this Medicare prescription payment plan allows someone who will meet the maximum out-of-pocket limit. Then they can spread the limit costs out evenly for each of the 12 months during the year. So for the $2,000 limit, this would work out to $166.67 monthly. This greatly helps the cash flow. In 2026, the maximum out-of-pocket for the prescription drug plans went up to $2,100 annually. And Medicare can actually negotiate the price on 10 to 20 high-cost prescriptions each year thereafter from 2026 to 2029. With all this change, the pharmaceutical companies were losing income. So what have they done? They have raised premiums on the drug plans and moved the tier levels around on many prescriptions. Okay, it's time to put everything together and look at your costs for the different options. You start by signing up for Original Medicare. The Part A cost would be $0 if you worked 40 quarters and paid taxes. The Part B premium is currently at $202.90 monthly. If you chose Part C, Medicare Advantage, then your premium will most likely be $0. You will still incur deductibles, copays, and coinsurance costs, but only if you use it. If you choose the Supplement and Part D standalone drug plan, the supplements would cost, on average, $316 per month for the G plan and $221 per month for the N plan. And the Part D drug plan can cost from $0 to $110 per month. So in this example, if you chose the Part C Medicare Advantage option, you would pay only the $202.90 per month for Part B, and Parts A and C would be $0. If you chose the Plan G supplement, $316 per month, and a drug plan for $0 per month, your total cost would be $518.90 per month. $316 supplement plus $0 drug plus $202.90 Part B. Financially, can you afford $316 monthly or $3,792 per year or $0 premium for a Part C Medicare Advantage plan? And this doesn't count in the extra benefits that you get no charge with a Medicare Advantage plan and would have to pay for with a supplement. You would always have to pay the Part B $202.90 premium no matter which option you chose. So, review your health, financial, and lifestyle needs, and we can help you decide which option is best for you. Are there penalties for late enrollment in Part B and Part D? Yes, there are, and they are lifelong. The Part B late enrollment penalty is when you don't get Part B when you are eligible. Then your monthly premium goes up 10% for each 12-month period that you could have had Part B but didn't sign up. The Part D late enrollment penalty is incurred when you went without creditable Part D coverage. Medicare calculates the penalty at 1% of the national base beneficiary premium per month, which is approximately $39 in 2026. You will have this penalty for the rest of your life while you are on Part D. So this works out to 39 cents a month for each month that you missed enrolling in Part D. Some people think they don't need a drug plan as they are not on any prescriptions right now or on only a couple of no-cost generics. Then their health changes and they need an expensive medication and they won't have a drug plan to help pay for it, and once they do get enrolled in a Part D plan, they will have a late enrollment penalty on top of all of the other costs. So, quick tip, enroll in a low-cost drug plan now, and some are still at a $0 premium, so you will have it when you need it. Step 2. It's time to compare Medicare Advantage versus supplement and PDP options. Let's do it. We have already gone through most of these items for each option, but take a look at this comparison slide. This should help you decide which option is best for you. We also have Medicare Advantage plans that are medical only and don't include drug plans. These are perfect for veterans who get their prescriptions from the VA. These $0 premium plans also offer $50 to $100 monthly givebacks. How do you choose which option to go with? Look at your health, financial, and lifestyle needs. We can review your needs, educate you on how Medicare works, and help you decide which health plan works best for your needs. We then help with the enrollment sign-up. And lastly, we provide year-round service and there is no charge for our services. We get paid by the carriers. You might remember that I mentioned that there are gaps in the policy's both Medicare Advantage and supplement options. What is a gap? A gap is the deductibles, copays, and coinsurance that you have to pay out of pocket. Let's take a look at some of these gap filler products. Supplements do not cover dental, vision, or hearing coverage, so you need to purchase these outside of Medicare. We can do this for you. There are many Medicare Advantage plans that don't fully cover dental, vision, and hearing as well. Some plans may cover preventive dental, exams, etc., only and not cover major dental, root canals, crowns, etc. Another important gap filler product is the cancer, stroke, and heart attack plan. They say that 2/3 of men will have some form of cancer in their lifetimes, and 1/3 of women. We all know of someone, family, friends, ourselves, that has had cancer. These are great, inexpensive policies that you really should consider. Hospital indemnity plans are a great way to provide coverage for your Medicare Advantage deductibles, copays, and coinsurance costs. For just a small amount of premium, you can cover these costs. You should really ask us about these plans. Besides these gap filler products, we offer final expense burial and life insurance. I firmly believe that everyone should have good dental, vision, and hearing coverage, especially as we hit our Medicare age. All Medicare Advantage plan customers should strongly consider hospital indemnity plans. And with the critical illness areas of cancer, stroke, and heart attack having higher probabilities as we get older, having this covered is very important. The total lifetime medical expenses for a 65-year-old retiring now average roughly $185,500. These gap filler plans can greatly help reduce your overall expenses as we age. Next, let's talk about the enrollment periods and how to sign up. There are quite a few enrollment periods during the year. Here's a quick list. IEP, Initial Enrollment Period. This is when you turn 65 and first become eligible for Medicare. AEP, Annual Enrollment Period. This is for Medicare Advantage and standalone prescription drug plans. It runs annually from October 15th through December 7th. SEP, Special Enrollment Period. This is when you move to another county, etc., and these SEPs can happen all year long. MAOEP, Medicare Advantage Open Enrollment Period. This is from January, February, and March each year. It is a one-time option to switch from a Medicare Advantage plan to another Medicare Advantage plan. This is great for the times when your doctor changes, the plan changes and doesn't cover everything you need. It's GEP, General Enrollment Period. This is when you don't fit into any of the above enrollment periods. Lastly, supplements have a different enrollment period. They have 6 months after you turn 65 to enroll without any pre-existing health issues, and it's guaranteed issue. After this 6-month supplement enrollment period, you can still get a supplement. However, you must pass health underwriting questions to qualify. Remember that you may also qualify for Medicare with certain disabilities, ESRD or ALS. Am I eligible to enroll? Medicare is for people age 65 and older and those who have a special condition or disability and meet Medicare's requirements. If you are a U.S. citizen or you meet the lawful presence and residency requirements, the initial enrollment period, IEP, is your first chance to sign up for Medicare. It starts 3 months before your 65th birth month, includes the month you turn 65, and ends 3 months after your birth month. So it's 7 months in total. We strongly suggest signing up early as there will be processing time for both your original Medicare card and your carrier plan options. Do I need to sign up for Medicare when I turn 65? Can I defer if I have employer insurance coverage? If you have job-based health insurance through your or your spouse's current job where the employer has more than 20 employees, then you don't have to sign up for Medicare. You can wait to sign up until you or your spouse stop working and lose your health insurance. If the employer has fewer than 20 employees, you may need to sign up for Medicare when you turn 65, even when you are still working, so you don't have gaps for creditable coverage and incur Part B and Part D penalties. If you are on COBRA coverage, this is generally not considered creditable coverage. You would need to sign up for Medicare at 65 or incur penalties. Initial enrollment period, IEP, when to get signed up for Medicare. It begins 3 months before your 65th birth month, includes your birth month, and extends 3 months after your birthday. See the calendar graphic below. It is highly suggested that you enroll in Original Medicare 3 months before your 65th birth month. You will want to allow sufficient time for processing by Medicare and the carrier's plans as well. Is there automatic enrollment into Medicare, or do I need to contact them? If you receive benefits from Social Security, you will get Medicare Part A and Part B automatically and won't need to sign up. Your new Medicare card will be sent 3 months before your 65th birth month. You then can work with Sanas Insurance to review your needs and see what Medicare plan options would work best for you. If you are under 65 and have been on disability for 24 months, 2 years, you may be eligible for Original Medicare, and they can automatically assign you an Original Medicare card at that time. How to get signed up for Original Medicare manually. Applying for Medicare is easy. You can apply in 3 ways. Online, www.ssa.gov. Click on the Medicare link to sign up for Parts A and B. Phone 1-800-63-34227 in person at your local Social Security office. We at Sanas Insurance can also help you sign up online during our scheduled appointment in just a few minutes, saving you time from calling or going in person. Supplement Open Enrollment. The best time to buy a supplement Medigap plan is during the 6-month Medigap open enrollment period. During this time, you can purchase any Medigap policy sold in your state, even if you have health problems. This period automatically starts the first of the month on your Part B effective date. Medicare Part B and you are 65 or older. If you apply for supplement Medigap coverage after your open enrollment period, there is no guarantee that an insurance company will sell you a supplement policy if you don't meet the medical underwriting requirements. Well, congratulations, you are all Medicare experts now. If you have any questions about what we went through today, just give us a call at 509-993-9887 or send us an email at sanasinsurance@gmail.com. Here is a refresher slide on our experience and what we provide for you. Check out our Google 5-star reviews too. To take the next step, call us at 509-993-9887 to schedule an appointment via Zoom, phone, or office visit. Visit www.sanasinsurance.com to learn more. Our services are free year-round, making it easy for you. You can research Medicare on Google and review hundreds of websites. You can also read all of the direct mail, email, TV, newspaper, Facebook ads, etc., and call on many of them and listen to their sales pitches. This option takes an enormous amount of time and sifting through information, not knowing what is accurate and what is not. Be careful with the information from the 1-800-SALES ads on television and the overseas call centers constantly calling you. Or you can simply contact us, schedule an appointment, get educated, get excellent help in determining which Medicare plan is best for you, and be done in 1 to 1.5 hours. And we are there for you all year round with no charge for our services. At Sanas Insurance, we live and work right here in Spokane. We know the local hospital networks, doctors, and Medicare plan options. We help people find a plan that meets their health, financial, and lifestyle needs. Please let us help you. Thanks.